For centuries, certain teachers guarded a simple candle-gazing method as a private practice for disciples, a way to steady attention, quiet the mind, and invite a subtle inner clarity, often called the third eye. Tonight, I'll teach you a safe, beginner-friendly micro-Trataka you can complete in 5 minutes. Before we begin, a short safety note. If you have a history of epilepsy, photosensitive seizures, serious eye disease, recent eye surgery, or other major ocular conditions, please do not use a flickering candle. Consult your physician or eye specialist first. If you're pregnant and feel uneasy with intense inward focus, check with your healthcare provider. This technique is supportive, not a replacement for medical or psychiatric care. A few words about Trataka. It's an ancient yogic practice built around a steady visual point, most traditionally a candle flame. The outer steady gaze helps steady internal attention. The act of soft, sustained focus tends to quiet habitual mental chatter and can make inner images or subtle sensations more noticeable. People commonly report calmer thinking, brighter dreams, or gentle forehead sensations after practice, but results are subjective and vary from person to person. Think of this as mental training. Steady the eyes, steady the attention, observe what opens up without expectation. Now let's prepare the space and your body. Choose a quiet, dim room where you won't be interrupted for about 10 minutes. A dim setting helps the flame stand out without plunging you into darkness. Avoid absolute pitch black. Use a stable, non-flickering candle if possible. White or beeswax is traditional, but any steady, unscented candle is fine. Make sure the candle sits on a firm surface and won't tip. Place the candle at approximately eye level so your gaze is naturally horizontal and relaxed. A good rule of thumb for distance is roughly 1.5 to 3 feet, about 50 centimeters to 1 meter. Closer will be more intense, farther will be softer. Pick a comfortable distance where the flame is clear but not straining. Sit with a straight, supported spine. You may sit on a chair or cross-legged on a cushion, whatever keeps your neck relaxed and your back upright. Rest your hands lightly in your lap. Keep your shoulders soft and your jaw unclenched. Have a small, gentle timer or alarm ready with a soft chime. Set it for 5 minutes. Choose a non-jarring sound so you won't be startled when the time ends. If you are concerned about any flicker affecting you, prepare an alternative focus, a small printed black dot on white paper, or a non-flickering LED candle set to a steady light. These are good options for eye sensitivity or seizure risk. Before we start, take a short breathing warm-up to settle the nervous system. Close your eyes and inhale slowly for 4 counts, hold for 4, exhale for 4, hold for 4, box breathing, and repeat this cycle 3 times. If counting 4 feels long, use 3 counts instead. The point is even, deliberate breath. Open your eyes gently when you're ready and return your gaze to the flame. If at any moment you feel dizzy, unwell, or emotionally overwhelmed, close your eyes, breathe, and stop the practice. There is no failure in stopping. Safety and comfort are the priority. If you'd like a printable 5-minute checklist to follow with this routine, a simple 1-page guide you can keep beside your candle, check the pinned comment for the download. That's the quick support tool for tonight's micro-Trataka. We'll now follow a precise 5-minute structure designed as a safe, effective introductory variant of longer traditional sessions. This condensed format keeps the essential dynamics, open eye steady gaze, followed by a short closed eye visualization, but reduces hold times so beginners avoid strain. Set your timer for exactly 5 minutes and follow these cues. Begin by grounding with breath for 30 seconds. Inhale gently for a count of 4, exhale for 4, maintaining a relaxed rhythm. Allow your gaze to soften toward the flame. Don't stare rigidly. After the breath warm-up, we'll repeat 3 cycles. Each cycle will contain 60 seconds of calm, steady, open eye gazing at the flame, followed by 30 seconds with the eyes closed, holding the inner image of the flame at the area between your eyebrows, the region often called the third eye. That pattern, 60 seconds open, 30 seconds closed, repeated 3 times, plus the initial 30 seconds of breath, yields exactly 5 minutes. You can use this rhythm tonight and, as you grow comfortable, extend the open eye phases or the number of cycles in later sessions. Now I'll guide you through it step by step. Remember, blink when you need to. Keep breathing soft and steady. If tears come, let them flow. There is no need to force your eyes open or to suppress normal reflexes. Start your soft breath pattern for 30 seconds. Inhale calmly, exhale completely. Feel the spine lengthen. As the 30 seconds end, bring your attention to the candle. Let your gaze rest on the lower part of the flame, the blue or yellow base where the light is the most stable, or on a consistently bright point on the wick. Keep your head still, let only the eyes move gently to meet the flame. For the next 60 seconds, maintain a steady, gentle gaze. Observe the flame's shape and movement without following every flicker. If your mind wanders, acknowledge the thought and bring your attention back to this tiny luminous teacher. Allow the eyes to blink lightly when needed. If blinking breaks the continuity, resume the gaze without self-judgment. When the 60 seconds are over, close your eyes gently. Bring to mind the after-image of the flame and place it, softly and without pressure, at the region between your eyebrows. Hold that inner image for 30 seconds. You might sense a faint luminescence, shapes, warmth, or a color. You might sense nothing at all. Whatever arises, treat it like weather. Note it and return to a neutral, observing posture. Let the breath remain long, smooth, and unforced. After those 30 seconds, open your eyes slowly and allow them a few calm blinks. Then return to the flame for the next 60-second gaze. Repeat the same open eye 60 seconds and closed eye 30-second cycles 2 more times. Keep the tone of your attention soft and patient. Do not push for grand visions or dramatic sensations. The purpose is to stabilize attention and notice what naturally appears. If at any point you feel eye strain, excessive dryness, or irritation, close your eyes and rest. You may end the session if needed. The timer will signal the end of the practice after the 3rd closed eye phase. People often worry about doing it correctly. There are a few simple checks that keep the practice safe and effective. First, your neck and shoulders should remain relaxed. If you find yourself tensing, release and shorten the following open eye phase. Second, your breath should be even and unforced. If you notice quick or shallow breathing, pause the gaze and return to slow breathing until it calms. Third, avoid pressing or squeezing the eyes during closed eye visualization. Rest the eyelids lightly. As you move through these cycles, you may notice common, benign sensations. Your eyelids may grow heavy, a cool or warm feeling around the forehead may arise. You may experience tears, a slight pressure behind the eyes, or an after-image of the flame lingering when the eyes are closed. These reactions are frequently reported and often reflect the nervous system settling. Many practitioners describe a gentle narrowing of mental noise, a clarity in thinking, or more vivid dreams in the nights following practice. None of these reactions are automatic or guaranteed. Treat them as signposts rather than goals. If strong emotional material surfaces, unexpected grief, anxiety, or intense imagery, allow the feeling space, breathe, and consider pausing practice until you feel more supported. If overwhelming emotions are persistent, seek guidance from a qualified mental health professional. After your timer rings at 5 minutes, close the session with a calm transition. Rest with your eyes closed for a few deep, grounding breaths. Bring your hands to your heart for a moment if that feels right. Take note of any immediate impressions, sensations, colors, words, shifts in posture, and consider keeping a simple journal nearby. Jot down what you noticed, even one word: calm, pressure, pink, dream. Over time, these short notes become a record of subtle shifts and can help you track patterns. If you experience any eye discomfort lasting beyond a short period, discontinue the practice and consult an eye care professional. Let's address a few troubleshooting points that commonly come up. If the flame feels too bright or causes tearing immediately, move it a little farther from your eyes or dim the lights in the room so the contrast is softer. If your eyes dry out, blink more deliberately and consider using artificial tears between sessions after checking with an eye doctor. If you notice dizziness or faintness, stop and breathe deeply with your eyes closed until you feel steady. If you experience intense visual disturbances, err on the side of caution and pause the practice. Such experiences do not necessarily indicate spiritual progress and may simply signal over-arousal or sensitivity. Regarding frequency and responsible progression. For beginners, start with this 5-minute micro-Trataka once a week for 2 to 4 weeks while you observe how your body and mind respond. If the sessions feel balanced and you're not experiencing undesirable effects, you can increase to 2 sessions per week, then up to 3 per week as your tolerance and comfort grow. Many experienced practitioners do Trataka 2 to 3 times a week. Some incorporate longer sessions of 8 to 11 minutes when they feel ready. Avoid intense Bailey long sessions as a beginner. The aim is steady, sustainable practice, not pushing for rapid transformation. If you find the 5-minute version supportive and easy, after a couple of weeks, you can extend by adding 1 extra cycle or lengthening the open eye phase by 20 to 30 seconds until you reach roughly 8 to 11 minutes, the traditional range used by many lineages. I'll share a full 11-minute progression in a separate video for those who want the deeper sequence. You may wonder about the third eye or pineal language often used around Trataka. Many practitioners use that term as a poetic way to describe the region of inner attention at the center of the forehead. Scientific claims about physiological changes should be made cautiously. Some people report sensations in that area, and many traditions frame the practice as fostering inner awareness. Treat such reports as personal, subjective experiences rather than universal promises. If you're curious about physiological mechanisms, read peer-reviewed material and consult reputable sources. Here, we keep our focus practical and experiential. For those who cannot or prefer not to use an open flame, alternatives are safe and still effective. Use a steady LED lamp placed at eye level or a printed black circle about ½ an inch wide taped to a white card. Fix your gaze gently on that mark in the same way you would on a flame. For people with photosensitive epilepsy, a printed dot or non-flickering LED at a constant brightness is the recommended choice. Avoid moving, flashing, or patterned lights. If your vision is limited in one eye, close the stronger eye and practice with the other, but consult an eye specialist if you have significant asymmetry or recent eye surgery. Some frequently asked practical questions. Can I practice if I wear glasses? Yes, you can either wear them or remove them depending on comfort. If the frame distracts you, remove them. If your vision is blurry without glasses, keep them on. What if I fall asleep during the closed eye phase? That's okay, especially if you're tired. Falling asleep simply indicates your nervous system wanted rest. Consider practicing earlier in the day or after a short walk if alertness is low. Is it normal to cry? Yes, tears are a natural release and are typically harmless. Are vivid dreams a sign of progress? They can be a sign of increased dream recall or altered sleep patterns. Many people notice changes in dreaming after regular attention practices. Again, none of these phenomena are required or guaranteed. They are possible outcomes some people observe. Integration after a session is as important as the practice itself. Keep a short notebook by your candle and write 2 quick things: what you observed and 1 practical note for tomorrow. For example, reduce distance or practice before dinner. If an emotional theme arises repeatedly, consider bringing it to a therapist or an experienced meditation teacher for support. Use the practice to cultivate curiosity rather than expectation. Over weeks, you'll likely notice small shifts: fewer distracted thoughts during the day, a gentler reactivity to stress, clearer dreams, or a steadier capacity to focus. Those are the gradual, sustainable results we aim for. A few closing cautions. Never use harsh, directed focus that causes eye pain or forces the eyelids open. Never try to induce visions. Trying hard disrupts the natural settling that yields insights. Do not stop prescribed medications because of an experience in meditation. If you have a psychiatric diagnosis or are in active psychological treatment, discuss adding Trataka with your therapist rather than making the change on your own. If this practice felt helpful, consider a gradual program to develop a steady routine. I've put together a 21-day guide that walks you from the 5-minute micro-Trataka to longer, mindful sessions with journaling prompts, gentle breath practices for settling, and safety guidelines for deeper exploration. If you're interested in a structured pathway with short daily checkpoints and reflection prompts, check the link in the pinned comment for details and bonuses. That guide is optional. This 5-minute practice stands on its own, but it can support steady progress for those who prefer guided structure. Before we finish, I'll repeat the simplest checklist to carry forward. A quiet, dim space, a stable candle or non-flickering substitute at eye level, an upright, comfortable posture, a gentle timer, soft breath, 3 cycles of 60 seconds open-eye gaze, followed by 30 seconds closed-eye visualization, and a quick journal note afterward. Keep the practice gentle, prioritize safety, and be patient with results. Thank you for taking this 5 minutes for yourself tonight. If you try it, please leave a comment below and tell me how it felt, or when you plan to practice next. I read your experiences, and they often help others feel encouraged. Be gentle with your eyes and your mind, and remember, this is a skill cultivated over time. If you want the printable 5-minute checklist or the 21-day program, see the pinned comment for links. Practice responsibly, and I'll see you in the next session.